urgent economic claim on the conscience of the nation. But what does that mean if we're talking about genetic research and technology? How does that translate? I want to turn to the Catholic tradition, and I want to briefly lay out three broad principles of discernment as a starting point for thinking about the obligations of justice in genomic advances. I want to point to respect for human dignity, relationality, and solidarity. These principles, for anyone who is familiar with the literature of bioethics, these principles are not incompatible with the familiar principles of medical ethics. Respect for human dignity, respect for the fundamental equality of all persons as imago Dei, as representing the image and likeness of God, presupposes that we respect every competent person's right to make healthcare choices in light of his or her own needs and values. It presupposes the right not to be harmed, exploited, or manipulated at the hands of a trusted provider, not to be discriminated against on the basis of genetic disease or susceptibility. And it presupposes respect for privacy in the use of genetic information. However, the Catholic tradition views the self in its totality as a unity of mind, body, and spirit. What this means in this context is that none of us can ever be reduced to our physical existence or to our genetic makeup, nor is the pursuit of biological existence the only value to be recognized in setting social or scientific priorities. Catholic social tradition also assumes that the point of medicine, the point of investments, is not only to live well, but it is to live well in relationship to God and to others. Having been made for God, human beings are inherently social. A Christian conception of justice, therefore, requires that we see ourselves as bound in a covenant of life with life, in which human freedom and choice is always coupled with a sense of social responsibility. The principle of relationality brings individual rights and duties into conversation with the common good, asking how choices create conditions for the flourishing of all members of a society. In the context of genetic technologies, a concern for relationality brings questions such as our responsibilities to future generations, how we set priorities for genetic research, how we weigh the advantages to be gained through genetic technologies against other means of addressing disease, disability, or death, and how we will distribute genetic services in light of the multiplicity of needs and the limitations in resources. Brings all of those questions from the margins of analysis to the center of analysis. And finally, and probably most important, as the US bishops argue, as individuals and as a nation, we are called to make a fundamental option for the poor. The obligation to evaluate social and economic activity from the viewpoint of the poor and the powerless arises from the radical command to love one's neighbor as oneself. Those who are marginalized and whose rights are denied have privileged claims if society is to provide justice for all. This obligation, writes the bishops, is deeply rooted in Christian faith. We tend to forget that these days, I think, since our rhetoric is about Christian commitments publicly, excludes some of those commitments. This concern for the poor or for those who are marginalized within community, which calls for active solidarity, follows from the Catholic tradition's emphasis on the importance of ensuring the capacity for humane participation for all members. Again, to quote the bishops, the option for the poor is not an adversarial slogan that pits one group or one class against another. Rather, it states that the deprivation and powerlessness of the poor wounds the entire community. The extent of their suffering is a measure of how far we are from being a true community of persons. Solidarity captures the sense in which the claims of justice exerted by the poor enjoin not only our emotions, but our choices about how we will produce and use goods, how we will organize our society. And their claims to justice, to a rightful share of what is owed, are not simply dissolvable into calls for charity. In the context of genomics, our enduring commitment to the disadvantaged and our option for the poor requires a careful and delicate balancing. For example, balancing the pursuit of the goods of genomics with efforts to ensure that the basic needs of all of our citizens and those most in need around the world are adequately met. Balancing the pursuit of genomics with meeting the health needs of the poor and effecting reform of an unjust healthcare system, and ensuring that the benefits of genomics are as available to the disadvantaged as they are to all other citizens. We could say a lot more about what these principles mean and about what they imply for medicine today. I want to offer just 4 reflections on the implications of this vision for justice in the genomic age. First, as one philosopher noted recently, justice begins by taking injustice seriously. If we are going to achieve any modicum of justice with respect to genomic developments in the long run, we have to address what is broken in our health care system today. As we've argued, genomic advances will surely result in widening gaps between haves and have-nots in our health care delivery system if we fail to address existing inequalities in access and quality of care. We absolutely have to insist that our national leaders answer the need for universal health care coverage and quality of care, regardless of race, ethnicity, or geography, as a national priority, and as a priority that is just as pressing as the war on terror. And I don't see that happening. Secondly, religious communities must take part in educated, substantive debates over how we as a nation ought to prioritize among areas of genetic research, how we ought to regulate genetic technologies in such a way that abuses and excesses can be controlled, while the interests of parents in maintaining rightful authority in reproductive decisions can be honored. How we ought to weigh the priority of public health interests in prevention of disease across populations with the promise of particular advances to address conditions for which other social and medical alternatives do not now exist. Whatever we may hope for by way of universal health care coverage in the future, it is obvious that a simple case for equal access to whatever technologies are developed is unsustainable. It's also increasingly clear that the line between genetic interventions that are therapeutic and genetic advances that enhance human characteristics, while very important in principle, is very fuzzy in practice. And the availability of genetic interventions can easily geneticize our experience. We're already hearing it's all in our genes. Religious communities in which human finitude is acknowledged and the presumption that we can avoid all human suffering is questioned are uniquely positioned, I want to argue, are uniquely positioned to debate the balance between investments in meeting basic human needs and improving quality of life across marginalized communities, and pursuing high-cost, high-tech solutions to genetic disease and disability affecting individuals.